In Texas, there are so many protections for the interest of the injured worker, be it a well-defined benefit system to ensure at least up to 8 weeks of income benefits are there for them. Our medical program provides protection for the life of that injured worker for related treatment. And our system is designed to make sure that carriers do what they need to do to pay benefits, treat workers with respect. We even added an Office of Injured Employee Counsel who is there to advocate and make sure injured workers' interests are protected. So I think here in Texas, it's a very strong system that injured workers have what they need, have the resources they need, and have the protections they need to deal with a post-injury in the workplace. Systems designed to have multiple protections in place for injured workers, be that protecting their access to income benefits when they have to miss work because of an injury, or protecting their access to medical care. One of the most important things that worker needs is to know they're going to have money there to take care of them and their family, as well as the health care they need to get better and have recovery for the remainder of the time that they're dealing with the injury. The system is designed to make sure those workers get the protection they need, get treatment they need, and avoid unnecessary and costly litigation. I think it's a system that works best to make sure we take care of the people who are vulnerable after a workplace injury. Antagonism in workers' comp leads to a lot of distrust. Injured workers are already dealing with trying to recover after an injury. And when there's some friction in the system, it creates a great deal of distrust, apprehension for that injured worker, and it makes it difficult for that injured worker to navigate a system that can at times be challenging, can be complex, but when we do have those friction points, it makes it tougher for everyone to get through something that is hopefully fairly routine, quickly resolved, and then everyone moves on to recovery back to where they should be. Talking about Texas, I had notes to talk about eliminating that antagonism creates unnecessary disputes, but I know Texas is different. We don't have a big court system, a great deal of litigation to resolve our disputes for a variety of reasons, unlike other states which seem to be more geared towards let's get in the court and fight it out. Probably the biggest solution is better communication. That sounds simple enough, but for the worker, it's understanding how the system works, having the carrier or TPA on the other side be willing and able to help explain how to navigate sometimes complex requirements and expectations and dates in the workers' comp system. I think it's building a relationship with that injured worker between the employer and the worker, not forgetting that worker, although injured, is still an employee. And then just opening the lines of understanding that the result of the system should be that worker gets the care they need to get back to the workplace, and that employer gets back a healthy and able-bodied employee, and the carrier pays whatever benefits are due. But ultimately, it's just making sure everyone understands what everyone's role is, and no one is there to deny, cheat, defraud, impede anyone getting health care or treatment that they need. Comp is not always that easy. So for the injured worker, the biggest challenge is figuring out how to navigate, not feeling overwhelmed, not feeling forgotten, and making sure that they are taken care of. Because in the end, I think injured workers just want to get back to as normal as it can be, but also back into the workplace.
I thought a lot about this, and it's interesting because this morning I actually had a discussion, believe it or not, with a widow, firefighter widow, who I had to explain to her that the death benefit for the loss of her husband was $150,000, literally an hour ago. So, that sort of informs my perspective on this. The short answer to the question is the current system and all of its various permutations does not adequately serve injured workers. And I say adequate because adequacy is foundational to our system. Adequacy is really what we talk about when we're speaking of the grand bargain more generally. And that notion of adequacy requires that we consider issues of fundamental fairness, both procedural and substantive, in the system writ large. So, in looking at this, I think there are plenty of examples where the system does operate to create a reasonable outcome, but there's simply too much tragedy where the statutory remedy is woefully insufficient to compensate for the magnitude of the injury or death. Where a severely injured worker or a surviving loved one is left disoriented, angry, and hopeless when confronted with the limitations of available benefits, the procedural hurdles confronting them, and the complete lack of alternative remedies, it becomes really clear to them in those moments how unfair the system can be. So, in the worst cases, I guess I would say workers' comp really becomes a trap, leaving injured workers and surviving loved ones with a sense of sort of a righteous indignation about the limited value of a life or a livelihood lost. We passed the cancer bill in 2019, and we are just being inundated with horrible cases involving cancer deaths. We've got this case this morning was a bad result following a surgical procedure on a cardiac presumption, probably a malpractice issue, and the unfortunate outcome is that the firefighter dies and the widow is grieving, and what do I do? And I have to tell her, well, they've tendered $150,000 death benefit for you. And that's really all there is. Antagonism is built into our system institutionally, although it might be suggested that this was never intended to be the case. Historically, workers' comp was devised as a no-fault system with limited recovery, where the starting point was compromise and consensus. This is precisely why workers' compensation and grand bargain are often thought of synonymously. So, what we have now is a default to contentiousness, where benefits are routinely denied based on a myriad of available defenses in order to avoid liability. And injured workers come into this equation expecting a fight, if they come into the equation at all, because there are lots of injured workers who simply don't want to make a claim because they don't want to deal with the system. So, I think the antagonism is built in. We have cynical characterizations of injured workers as frauds and laggards and greedy schemers or unethical opportunists. And that exacerbates the problem. And I can't tell you how, that resonates. That message, I hear it over and over again. And the focus on, this person is a fraud, or these fraud defenses are being raised in response to litigation, when really it's just an opportunity to try to deny a case. So the characterizations, these cynical characterizations, are really destructive to the system. And I would say on the other side of the equation, injured workers also cynically believe that the system is intentionally operating to favor insurance interests and profits at the expense of those that it is intended to protect, right? So there's the other side of this, where injured workers also are looking cynically at the system. When you add to that the perverse financial incentives that exist, it just feeds a narrative, and the cycle sort of perpetuates itself over and over again, feeding this antagonism that you're describing. This is a great question for me to try to answer for you. After the 2016 constitutional decisions in Florida, we actually convened, the governor convened a panel to look at the work comp system and some of the constitutional vulnerabilities in our system. And in order to bridge the gap, I think what's required is that we put aside this sort of sense of tribalism that is infecting the system, and that stakeholders should begin working together collaboratively to clearly define where the system is failing and where the system could be improved. Because I don't think there's really much question in anybody's mind that there are certain areas where the system is failing and could be improved. I think stakeholder work groups could find areas of agreement and focus on things like adequacy, simplicity, and efficiency to improve the system. And through that type of collaboration, you begin to bridge the gap. But it requires that we all kind of put down our weapons and meet somewhere in the middle. Ultimately, the way to bridge the gap, at least in my mind, is always to remember that this system is a compromise of competing interests in hopes of buttressing what are common interests. Because employees should really want what's best for the employer, and vice versa. The employer should always want what's best for the employee. If we can keep that in mind, I think it creates opportunities for us to bridge the gap and create a better, more workable system for everybody. I think, unfortunately, the only time that discussions like that really happen is where there is a decision that the law is unconstitutional. That's why I raised the issue in Florida. After those 3 constitutional decisions were issued in 2016, there was a real fear that the whole ship was going down, that the whole Florida Workers' Comp Act could be found unconstitutional. And so that really got everybody to the table. And then we can start talking about things that we could agree on, like, for example, the $150,000 death benefit. Well, that's just not sufficient in anybody's mind. And it's been in our statute, for 30 years now, I guess. I don't know. So isn't it time to update that? And isn't that something that everybody could agree on? The value of a life lost is certainly more than $150,000. So, those are the types of things, if you can find low-hanging fruit, I think there's a way for us to come together to improve the system, both in terms of benefits, benefit structures, and also procedural systemic improvements that would make everything more efficient and hopefully less contentious.